At eMend Healthcare, vital signs are a frontline safety tool. Mastering how to monitor and escalate them protects vulnerable clients from preventable harm. People with serious mental illness often die 10 to 25 years earlier than the general population. This is largely due to cardiovascular and metabolic conditions, which are frequently complicated by the psychiatric medications they take. When you perform physical assessments, you must respect the client's privacy and dignity. At the same time, you are upholding their fundamental right to rapid, effective medical care when their body indicates something is wrong. Taking a client's vital signs translates invisible physiological data into actionable facts. It gives you exactly what you need to make life-saving decisions on their behalf. This flowchart maps when to take vital signs, starting at the admission baseline, the core reference point for every future measurement. From there, specific events trigger immediate checks: before a new medication's first dose, after a fall, or during a behavioral change like sudden confusion. Many medical emergencies are completely asymptomatic in their early stages. If a trigger event occurs but the client claims they feel fine, you still take their vitals. Subjective feelings cannot override objective clinical protocol. The numbers on your equipment are non-negotiable. They strip away the guesswork and tell you exactly how the client's body is functioning in that exact moment. This dashboard tracks 6 vital signs altered by psychiatric medications. Normal blood pressure is under 120/80. 180/120 is a hypertensive crisis requiring 911. Normal pulse is 60 to 100. Under 50 or over 130 demands immediate emergency response. For respirations, people naturally change breathing if they know you're watching. Keep your fingers on their wrist as if taking their pulse, but shift your eyes to watch the rise and fall of their chest for a full 60 seconds. Combining benzodiazepines and opioids risks respiratory depression. Normal respirations are 12 to 20. Below 8, or oxygen saturation under 90%, call 911. Normal temperature is 97.8 to 99 degrees. A high fever of 103 or above is a critical emergency. If a client takes an antipsychotic and develops a high fever, combined with severe muscle rigidity, suspect neuroleptic malignant syndrome, or NMS. Hold their next medication dose and call 911. Normal fasting blood glucose is between 70 and 99. If it drops below 54 or spikes above 400, the client is in a diabetic emergency requiring immediate paramedic intervention. By tracking these core numbers against a client's specific medication profile, you intercept lethal side effects before they turn fatal. Certain antipsychotics cause orthostatic hypotension, a dangerous blood pressure drop causing falls. Catch it in 3 steps. First, client lies flat for 5 minutes and you measure. Second, client sits for 1 to 3 minutes and you measure. Third, measure within 3 minutes of standing. Compare the numbers. If the systolic pressure drops by 20 points or more, or the diastolic pressure drops by 10 points or more, the test is positive. Implement fall precautions and notify the prescriber. Mastering this 3-step positional dance ensures you catch the blood pressure drop before the client hits the floor. Process vital signs using a 3-tiered escalation protocol. First is routine. If values are within normal baseline limits with no symptoms, document and continue scheduled monitoring. Second is notify. For abnormal, non-critical values, document and contact your supervisor to alert the prescriber. The top tier is emergency. If a value hits any of the critical thresholds we've discussed, you call 911 immediately. You never need permission from a supervisor to call 911. Call first, then notify your team. Your role is strictly to measure the data and escalate it. Let the paramedics and emergency room physicians handle the medical diagnosis. When you recognize clinical triggers and track the big 6 vital signs, you neutralize medication side effects before they cause permanent damage. By meticulously performing the 3-step orthostatic check, you protect clients from sudden, devastating falls. And by enforcing the unbreakable rule of critical escalation, you ensure that the moment a lethal threshold is crossed, you dial 911 without hesitation. You measure, you document, you escalate. Your swift, precise execution of this protocol is the ultimate barrier between the client's vulnerability and their total safety.